After surgery, while the bleeding is controlled and blood pressure more stable, Willie's lungs start to give out. Respiratory therapist Robert Hawkins works the ventilator to try to improve oxygen levels. Neurosurgeon Dr. William Christie is concerned about Willie's brain and orders a CT scan as soon as possible. As the levels of oxygen improve a bit, he is taken to the scanner to evaluate all his injuries from head to toe. The brain looks fine, but his pelvic fracture is much worse than initially thought. From the scanner, he is taken to the surgery trauma intensive care unit. The next 3 days are a constant battle to get his lungs to push more oxygen into the blood. Everything is thrown at him. Pharmacist Greg Chenault works out a cocktail of drugs, including antibiotics, in case he's getting an infection. A new drug meant more for infection-related organ failure than for injured lungs, and high-dose steroids that might actually increase the chance of infection, but may help the lungs. Trauma Chief Resident Dr. Charles Fields asked that the ventilator be changed to a different kind that is not often used on adults. A special mixture of oxygen and nitric oxide is given to him. A catheter is placed in his heart to accurately determine the amount of blood, amount and type of fluids that he should get. Too little fluid and the body remains in shock. Too much fluid and the lungs get waterlogged.
I got a report that there was a young man who had been in a bad automobile accident and he was not expected to survive. And when I went up to the recovery room, received him on the ventilator, I just didn't leave, couldn't leave for almost the entire shift. He was really bad. Brought him out, got him ventilated, trying to oxygenate him.
A lot of times trauma patients, they have kind of a honeymoon. The first 24 hours, they don't look as bad as what they're gonna look. He looked bad, pretty bad from the beginning, and I knew it was only gonna get worse from there.
And I came in on a Monday night to take care of him. When I walked in the unit, the other staff nurses said, "Oh, you're going to have a tough night," which happens a lot. And I walked over and got report, and within the first hour, he was not doing well at all. His parents were at the bedside. I asked them to leave so that we could try to help do things to get him better.
I remember they placed chest tubes, of course, for his collapsed lung, and his lungs actually had a hole in them, so that when the ventilator would give him a breath, you could see the air from the ventilator rush out through the chest tube. You could see it bubble. So his lung was injured that bad.
Well, Willie's lungs were severely bruised, very damaged. He had multiple chest tubes because his lungs had essentially popped from the accident, and he had severe leaks from the lungs themselves, which required all the chest tubes. Well, that in combination with the bruising from his lungs, he just couldn't, mechanical ventilation wouldn't work for him. The oscillator works on a little bit different principle, where instead of having a traditional rate of 12, 14, 16 breaths a minute, we use rates of 180, 240, 300. So by doing that, we can effectively get rid of CO2 without causing any further damage to the lungs.
His case was kind of complicated in that he also had this respiratory drive issue, and so feeding him enterally was going to be really important, because I could also try to help keep down the rate of infection, but I had to be careful how much I could feed, because I had to make sure that respiratory and his lung function were going to manage.
He had been stable for a couple of days, and everybody was sort of breathing a sigh of relief. And then one day he was just very sick. Everything was off. and almost felt that if something is wrong, it has to be in the belly, and he was too sick to take to the operating room.
When a patient is too sick to come to the operating room, we take the operating room to the patient.
Sure enough, we found dead bowel. Cut out the dead bowel. That really helped stabilize him.
Since Willie is so unstable that dead gangrenous bowel is removed in the ICU, but the two ends are not connected and his abdomen is once again left open. With the dead bowel gone, Willie does stabilize. 2 days later, he is taken to the operating room. The bowel ends are connected and the belly is closed for the very last time. After this, he starts to make a slow but steady recovery. However, his lung injury continues to be a problem. The oxygen levels stay low and the CO2 levels stay very high. They reach near record high. The team concentrates on the oxygen levels since the high of CO2 only gives him a flushed feeling and a bad headache, the least of his problems. On hospital day 23, orthopedic surgeon Dr. William Zulzer fixes his thigh bone fracture. On hospital day 33, he is given a tracheostomy to help come off the ventilator. As he gets stronger, physical therapist Bridget Goodsman works with him to start rehabilitation, which continues at Walter Reed Army Medical Center at Washington, D.C. after discharge.
Willie was one, at the time that he was really sick, was one of the sickest trauma patients that we had ever taken care of. And it took the whole team to take care of him. It was definitely not just nursing. It was the residents, the attendings, the respiratory therapists, the physical therapist. It took everybody to help take care of him.
Multiple chest tubes, multiple resuscitations, multiple trips to the OR. It was totally abnormal, actually. I mean, this was literally, honestly, a guy who should not have survived. And so it was full tilt boogie, and we just had to keep going. Just had to keep going. He didn't give it up, we didn't give it up, and he made it.
For him, we would check on him, check on Heather, check on his parents, pray, visit, and do a lot of listening as they reflected on what had happened, how he was doing, the uncertainty.
It does our hearts good, and it lets us know that no matter what the salary is we get paid here, to see somebody come back and say, hey, thanks, you couldn't ask for anything better than that. He had a drive about him, and he was determined to make it, and he did. And that's what gets people through the STICU or the trauma experience.
They are, you know, shining stars. I'll never forget certain people, and we talk about them still to this day. The ones that really made an impact. And they were all wonderful, but there were several, his main nurses just really made an impact on both of our lives. Helped me get through it, and I know helped Willie get through it.
In all, Willie Christie spent 133 days at VCU Health System. 133 days. During that time, his dad offered his lung for transplant to Willie, telling the doctor, I've got 2 good lungs. Can Willie use one? It wasn't needed. During that time, his mother broke her wrist and required surgery, yes, at the trauma center. And his friend Heather rarely left his son.